Cameroon is a developing country in Central Africa. It is bordered by Nigeria, Chad, the Central African Republic, Equatorial Guinea, Gabon, and the Republic of Congo, with a coastline along the Gulf of Guinea. Because of its location, Cameroon is geographically and culturally diverse. We are Health Education in Cameroon. Our mission is to educate the Cameroonian people and train midwives and nurses to reduce the number of pregnancy-related deaths and HIV/AIDS infections in Cameroon.
Cameroon has a fertility rate of 4.64 and the average age of the mother is about 19 years old when she has her first child. The physician's density is 0.08 to 1,000, which is part of the reason there is a lot of pregnancy-related deaths in this country. 50% of the world estimate of maternal deaths occur in sub-Saharan Africa alone. Postpartum hemorrhages and unsafe abortions account for half of those deaths. The upsetting fact is that the majority of these deaths are preventable. HIV/AIDS affects about 4% of the population in Cameroon. This virus weakens the immune system, which is a problem in Cameroon specifically because there are a lot of diseases like malaria causing people with weak immune systems to die at a faster rate than HIV/AIDS alone, which can explain the young age of the population. The lack of education, especially for women in Cameroon, contributes significantly to both of these issues. Our plan is to build 3 small health clinics in 3 central rural cities in Cameroon. These buildings will provide Cameroonians with a safe place for health needs and health education. Each clinic will have vans for the clinicians to use to go to houses and give medical aid or transport people to the clinic. We will also provide training on safe and clean delivery practices, newborn care techniques, and HIV/AIDS information and prevention. By providing this education, we hope that this new knowledge can be passed on, which would contribute to the decrease of maternal-related deaths and the spread of HIV/AIDS in Cameroon.
In order to incentivize our program, our healthcare, testing, and educational services would be free. In addition to building clinics in rural areas, we would also provide transport for midwives and healthcare services to communities in need. All communities, regardless of access to transportation, would have access to our services.
We have identified 3 nonprofit organizations that could potentially be willing to assist our organization in the implementation of our development plan. The first is the War Trauma Foundation. This organization has partnered with the United Nations High Commissioner for Refugees to start the Mental Health Global Action Program. The War Trauma Foundation provided training to clinical staff, including midwives, in Cameroon. With their experience, they can help us in our mission to train midwives. The second partner is the African Aid Organization. They are an organization based in Washington, D.C., whose mission is to provide youth with the tools, knowledge, and resources to protect themselves against HIV/AIDS and other sexually transmitted infections in Cameroon, Burkina Faso, and Uganda. Their knowledge and resources would help us in our mission to educate the Cameroonian people on HIV/AIDS prevention. The third partner is Almazo. This organization is working to improve the lives of young women in Cameroon through tuition-free access to high school education and resources that help girls stay in school. Women's education is crucial in preventing HIV/AIDS. This organization could help us in forming effective course plans and identify good and capable specialists and teachers for our HIV/AIDS education. Together with these implementation partners, we can achieve our mission and improve the lives of many Cameroonians.
There are some risks in implementing our program. Most of the midwives and nurses trained would be women. However, in Cameroon, there is a stigma in women seeking higher education and vocational training. According to the Advocates for Human Rights, women face many barriers that keep them out of education, such as poverty, pregnancy, early marriage, domestic responsibilities, and cultural and religious traditions. These factors could prevent them from training and working as midwives and nurses. Another risk is the stigma and discrimination associated with HIV and AIDS. HIV is highly stigmatized in Cameroon. Some employers and banks require to see medical forms before giving loans or employment, and therefore prevents people from getting tested. Testing for HIV and AIDS could unintentionally expose individuals to discrimination based on their diagnosis. In order to monitor the success of the program, we will track the usage of our services and what communities we serve, including the locations where services are transported to. In addition, we will also track the number of people trained in the midwife program and where they are transported to. In order to assess what services are used, we will track the number of successful assisted births. Finally, we will track the number of people that get tested for HIV and AIDS at the clinics. Keeping track of the usage of our services will show us where we can improve and how we can maximize our impact.